Look at a healthier Tiger Woods making some swings. Of course, the news of another back surgery for the name still in and around professional golf as we welcome in Dr. Andrew Casden, Chief of Orthopedic Surgery and Spine Surgery at White Plains Hospital. And Mr. Casden, Dr. Casden, I want to start simply by asking, this is a surgery Tiger has gone through multiple times. Can you speak in terms of layman's terms on what this means for somebody going through it and what we should see in terms of a recovery?
Yeah, sure. Thank you. He had a microdiscectomy. That means from the back, they make a small incision, go down to the spine, and take the pieces of the disc that are pressing on the nerve out. We don't remove the entire disc. We just take out pieces of the disc, and you can actually watch the nerve that was under pressure from these pieces of disc free up and be normal again. But the disc is not a normal disc anymore. It never will be completely normal.
That said,
now,
what's the post-op protocol for him then if it's not a normal disc?
Okay. When this disc leaks out and presses on the nerve, it causes a hole in the structure that's supposed to be holding it in place. So I would look at his recovery in two phases. One is healing from the surgery itself, and then the rehabilitation to get back, hopefully, to golf. So it's at least 6 weeks or so just to let things heal up. That little hole we want to scar in again so that more disc can't come out. That is one of the things that probably had happened to Tiger in the past and why he had so many back surgeries is that hole just continued to leak disc material. So first we're going to let him heal. They're going to let him recover from this surgery, and then begins the rehabilitation process.
Dr. Casden, we've seen Tiger go through a lot of surgeries, a lot of back issues, knee issues over the years. As a 45-year-old, is he capable of getting back to 100% health-wise through all of this?
You know, I think it is. This last procedure was probably a result of the pressure on that disc above the fusion level where he had the last surgery. But we only take out a small piece. The disc, it will never be normal, but it can be to the point that I think he can get back to golf again. It's going to take a lot of work on his part, which he's obviously done in the past, but I think he can get back.
So, doctor, you say he can get back, but how many more times can he undergo the knife? Third back surgery, fourth back surgery, fifth back surgery. Is there a limit on how many surgeries anyone can have on their back?
There's not a limit, but obviously at some point he'll say it's enough already and I'm ready to retire. I mean, there's no question the stress on his back from his profession is what's causing this to happen. And at some point he will say, I can't do this anymore. I can't keep undergoing surgery. But unfortunately, there is the possibility of more surgery in the future for him. But hopefully not. You just don't know.
We'll wait and see how this rehabilitation goes for the 15-time major champ. We appreciate Dr. Andrew Casden on this Wednesday. Shane, so you heard him. This is someone who can get back to 100% and get back to playing golf and potentially, I mean, we'll see, but maybe winning golf tournaments again.